Namaste. Myself, Dr. Samya Vuyanubat. I'm a chief consultant at Diabetes Research Care, Bandit. So I'm over here today to talk on the topic peripheral neuropathy. If I have to be very specific, diabetic neuropathy. In that, it includes many other particular nervous system. So people are like, whoever comes to us, they are no more with like diabetic patients. Whoever comes to us, they are no more with the classic symptoms of diabetes, like increased hunger, sweating, urine frequency. Most of the patients even say they don't have a single diabetic classic symptoms, but still they always come. If it is a chronicity, is also before I speak about diabetic neuropathy. What is diabetic neuropathy? In simple terms, you have to understand it's a complication of diabetes. Okay. So when does the complication occurs? When you have been suffering from diabetes, at least a minimum of 5 years or more, and then you have started with a nervous issue. So you have ended up with a complication. But it is quite unfortunate. I could see whichever the patient I get, recently diagnosed, their basic symptom is something related to neuropathy. So they have started with a kind of a tingling sensation on those eyes. So the patients are saying, I have diabetes, so I think I have this neuropathy. And it has become a very common word. I think some complications category, the neuropathy would be shifting to a diabetic symptom very soon. Because everybody whoever is suffering from diabetes, I could see neuropathy as a part of it. I mean, they have already started the complications. So in earlier days or decade back, the patients, whomever I used to say, they used to develop a diabetic neuropathy after 5 years of undergoing the diabetes, and they also have a kind of a blood pressure issues, and they are on some other cardiac issues, and they are on ventilators or statins, and then they have started with a neuro. But what I can see now is, it's very clear, they are starting diabetes with a diabetic neuro. That is how the patients are presenting with the symptoms. So patients are also worried, doctor, when I should be really worried if it is damaging my nervous system. Yes. So basically, neuropathy is a condition where your nervous system starts getting under damage when you have an uncontrolled sugar level for a longer duration. But nowadays, what I would say is that FPS and big pills will be quite normally or quite in a range for a long term. Still, that A1C may not be normal. This is what, through my experience with the practical whatever the cases we see. The people who have a higher A1C levels, that is more than 7%, for more than a year or two, they are more prone to starting with the neuropathy issues. So let me just review what exactly happens in diabetic neuropathy. So neuropathy, it is very clear, the nervous system damage, and it is of like 4 major types, if I have to say. That could be like peripheral, autonomic, proximal, focal nervous system. So wherever the nervous supply is there, depending on that affected that particular nervous system, we categorize that. So most of the patients, what we see is the peripheral neuropathy, where it involves your peripheral parts of your body. It's like hands and legs. Sometimes some patients also say they get a kind of a burning or a pain of the abdomen. So what they say, they generally get a scan done and everything seems to be normal. That is also involved in neuropathy, abdomen and back sometimes. So those are majorly comes under the peripheral. There you can see the regular symptoms. They could be a teeth sensation, numbness, or burning feet. So or they also feel like something is running up by a foot. So that comes under the peripheral neuropathy. When I say autonomic, it majorly affects the digestive system of the person. So that those patients complaints of kind of a diarrhea sometimes, constipation. Sometimes they also mimic IBS symptoms like irritable bowel syndrome. That also we have seen in the patients. So some people they think it's a gastric issues. They also feel like heartburn and nausea, which was not at all there before. Or some patients behave like, the doctor has changed their diet medicine and then it has started. No, that has nothing to do with exactly. But we suffer from autonomic, neuropathy. I mean, their digestive system is being affected. So other is like, it also goes from kind of particular organ based also. Let's say like if you go with the blood vessels, that depends on how it has supplied to the other body parts. So some blood vessels has been affected, some people, that is how they start with in the males majorly. So if it could go with a kind of a vomiting, nausea, but that would also go with the erection issues. So they will tell the doctor, my sugar level is under control. My sugar level is also normal, but I don't have a proper erection nowadays. So that means your blood presence is being affected. Then also there is no proper blood flow for that particular organ of your body. That could also happen in females, that their private organ, whatever the blood supply is happening to that particular private organ has been reduced. They might start with a kind of other symptoms. They might also lose orgasms. So they might not really have a kind of interest for the sex. So this is also part of when your nervous system is being affected. So I would say in that case, you should not be scared. You just have to go with a proper counseling, and you have to track back all your symptoms, track back your sugar levels, how are you doing. And you should also start the best thing for pulmonary neuropathy patients, and what I advise is, first thing you have to do is improve your blood circulation. The best exercise is cardio. Never ever stop your cardio. The cardio would definitely, I would say, at least 30% improvement you can see without or with your sugar levels controlled or not. So this is about if I start speaking about the organ ways, it's not like if it is affected your bladder, nervous system, whatever supplies to your bladder, then it could be like more of urinary incontinence might be there. So more of frequency. Even the sugar level is under control. You might be getting urination frequently. That might be a symptom of your neuropathy. So it is very, sometimes it will be a task for your doctor to understand whether it's a neuropathy or any organ-based, any other problem has been arrived in your body. But when you're a diabetic, you are doctor, we have to be very, very careful to understand whether you have started with any nervous system damage with controlled sugar levels or without a controlled sugar levels. I could also see both, but for that controlled sugar levels. So whenever you get to know, you first thing you have to do is keep a track on your sugar levels very frequently, at least monthly twice, and get your A1C done. And third thing is, talk to your doctor and tell them don't ignore any small symptoms. We share with them and tell them whatever your lifestyle have changed or any habits you have started, everything should be disclosed so that it will be more easy to rejuvenate. We have to stop the degeneration. We cannot stop or we cannot reverse completely the damage happened to nervous system. That's a one more drawback, I would say, that's unfortunately we can't do that. But we can definitely rejuvenate, and we have to postpone that damage, whatever has happened. So this is about diabetic neuropathy, which majorly induces peripheral neuropathy. Thank you.